I've been with the clinic for 30 years because I want to serve the kids from Mexico, our kids.
This is a population that is extremely underserved for many different reasons, and the fact that we can come help alleviate some of that need is really important.
I think we'd like to come back down here and do some volunteer work.
You don't believe what you see and how much good is going on here.
St. Andrew's Clinic is a non-denominational clinic that was organized by efforts of people on both sides of the Mexican-American border. Our goal is to help children who have different orthopedic and pediatric needs. Back in 1974, the clinic started off as just an orthopedic clinic. As time has gone on, services have been expanded to try to provide more comprehensive evaluation. We now have over 20 subspecialists who come down, and that includes pediatric cardiologists, pediatric dermatologists, and pediatric neurosurgeons. Now we have occupational therapy, we have speech therapy, we have nutritional services.
¿Estás feliz?
The clinic was started by Dr. Mark Frankel in association with some local families on the Nogales, Mexico side. In 1973, they were able to secure a convent in a somewhat rough neighborhood of Nogales, Mexico. So these were very humble settings. The clinic moved to the American side in 1976. It was 1978 that the St. Andrew's Parish essentially adopted the St. Andrew's Clinic as their favorite charity.
And that's basically how we started, and we continued to grow in this location. And here we are now, a rather huge clinic that sees probably up to 200 patients at a time, and feed their families and accommodate a large crowd every Thursday, first Thursday of the month.
And what we do every month with the pediatric side is we see patients for follow-up. It's for children mostly that have congenital problems. A lot of them have seizure disorders or neurologic problems. And we basically are their primary care doctors in the U.S. It's for uninsured children in Mexico.
I was a little 9-year-old girl with a disease called Sturge-Weber syndrome. She was having problems with nausea and vomiting. It seemed like her symptoms were most likely due to reflux. So I gave her some reflux medicines, and hopefully she'll be doing better.
Taking a measurement for a thumb brace, and then when she comes back next month, we'll do the fitting and make sure everything looks good, and hopefully get a little bit more functional.
These are very poor people. These are people that hardly eat. There's no way that they could afford a hearing aid or a crutch. I've been with the clinic for 30 years because I want to serve the kids from Mexico, our kids. And I've seen the doctors do wonderful jobs. You know, a lot of them get a better quality of life.
When you have a child who hasn't walked and you give them a walker and they can walk independently for the first time, it's not something very dramatic that we do, and it's not as fancy as surgery or involved physical therapy, but you just give this kid a walker and all of a sudden this kid's independent. The face lights up. The kid had no idea they could do that. Fortunately, in the United States, there is care available to just about everybody. You come down here, it's just not true.
Unfortunately, I think that's one of the biggest reasons why people come, because they don't have medical insurance that they can rely on to obtain certain services or access to their physicians. We try to have the child stay as close to home as possible. We try to get tests done in Mexico. We try to get them to see physicians in Mexico as much as possible so that we can partner in their care. If we feel that there's a child that needs some surgery here in the United States, they will either come to Tucson or they will go out of state under the care of the Shriners Hospital.
Rodrigo is very special to us. When he was 2 years old, we were assigned to pick him and his mother up at the border, La Línea, and take them to the airport, and they were going to the Shriners Hospital. He and his mother were headed knowing that he would have his leg amputated and be fitted for a prosthesis.
There are very limited resources for prosthetics in Mexico. And one of the problems with that is with the kids, they grow so quickly and the prostheses have to be replaced so often that it makes it very difficult to afford. This particular one, it's around probably $2,000 to $3,000.
Okay, Rodrigo.
3 months later, we went to the airport to pick him up, and Rodrigo came running off the airplane on his new leg. In 3 months, he was able to walk on it.
Simplemente cuando me dijeron pues que le iban a apuntar el piecito al niño, pues
When they said they would amputate my son's foot, well, it felt horrible. Simply put, he wouldn't have been able to walk. With a prosthetic, he can wear any tennis shoe he wants and get around as he wishes.
Usar los tenis que él quiera, andar como él quiera.
The donations that we get from people are what make that possible. That's what makes that possible.